Okay, I think we'll go ahead and get started. There are about 50 of you that have logged in so far, so that's more than 2/3. Welcome everybody to the first virtual Lifespan Respite Grantee and Partner Learning Symposium. I'm Jill Kagan with the Arch National Respite Network and Resource Center. And I have with me today Susan Summers, Cassandra Furman, and Ray Kirk with Arch, and our wonderful friend Emily Turner, who will be on hopefully to help us with any technological glitches in the beginning of the day. I know that we're all so disappointed that we are not able to meet in person this year. But I'm really excited that we still have this opportunity to connect and share with each other. So thank you all for taking the time to commit to the next 2 days with us. I did mute everyone for right now, but you do have the option to unmute yourselves if you have something wonderfully urgent that you need to let us know about, or of course you can always let us know any concerns or technology issues or questions that you have by entering it into the chat box. And I'm sure most of you are familiar with Zoom by now, if you've Zoomed as much as we all have. If you hover your mouse over the bottom of your screen, you should bring up a black bar full of menu items, and you'll find the chat box there. You'll also find the list of participants if you're interested in seeing who else is on the call. We do have more than 65 of you with us today. So we're not going to take the time to let each person introduce themselves. One person from each state, of course, will be able to do that when we enter the bring, brag, and borrow session. But to kick off the discussion and get you used to using the chat box and to set the tone for the next couple of days, I invite you to ponder this question as we begin the session today, and just type into the chat box what it is that you hope to get out of the Learning Symposium over the next 2 days. And let us know what state you're from as well when you respond to that. And we'll monitor your responses as we proceed today and review them tonight, with the hope that we'll be able to address at least some of them before the close of the symposium, or at least in the very near future. As we convene today, we'll be celebrating your accomplishments over the last year, including all the creative ways that you've altered or adapted your grantee or other coalition activities to the current pandemic. I know that's where we've all been focused for the last couple of months. During the last couple of months, we've also been learning so much during our COVID-19 and respite calls and through our other communications about all the innovative ways that you are continuing to provide respite safely, to develop and do virtual volunteer and phone supports to the caregivers and coalition members you're serving. But I think the way that we deliver services now, the way we educate caregivers and other stakeholders about respite, and even the way we communicate and provide supports may never be quite the same again. But as we think about the future and what it holds, we hope that you will learn from each other over the next 2 days and by staying connected over the next few months, and that this will make it easier to plan for and adapt to any new and emerging scenarios. I think it's especially timely right now because in addition to celebrating Older Americans Month last month in May, May was also Mental Health Awareness Month, and in a very timely way, yesterday was also World Elder Abuse Awareness Day. And these commemorations, I think, are especially noteworthy at this time because they give us the opportunity to reflect on how respite can be even more important for family caregivers now during this pandemic crisis. We know that stress and anxiety may have drastically intensified for many caregivers and their care recipients at this time, at a time when everyone is more socially isolated than ever. So respite may be the only service a family caregiver is receiving, and we may be the only service providers that they are in contact with. So I really just want to take the time to thank all of you for what you're doing to keep family caregivers connected and supported, to help them keep their care recipients safe, and also to continue to think creatively about how to provide respite in the future. So we really have our agenda set out for us for the next couple of days, in addition to all your wonderful bring, brag, and borrow presentations. Before I introduce our first speaker, I wanted to go over just a few logistics. I know most of you have been spending, as I said earlier, a lot of time on Zoom or other virtual connections, and we know 3 hours is a long time to ask you to sit in front of your computer screen. As you can see, we have built in a short self-care break at 2:45, so you can at least stand up and stretch or move around, take your dog for a walk, whatever you need to do. But please feel free to take a break whenever you need to. We are recording the symposium right now, so even though we hope you'll, of course, be quite attentive when your colleagues are presenting their bring, brag, and borrow, just know that if you get up and have to leave for a minute, you won't miss anything, because we will be making the recording available on the next day or two. During the wrap-up today, if we still have some time, I will be providing a quick ARCH update on some of our new products, what we have planned for the future, and coming events too. So you may want to hang around for that at the very end. Tomorrow's agenda is very similar to today's. Most of you registered for both days, which we're really delighted about. And I do want to let you know we have a very special guest tomorrow. Administrator and Assistant Secretary of Aging Lance Robertson will be with us for some brief remarks. So I know you will not want to miss that. We're really so honored that he'll be joining us, and I think it's testament to his commitment to family caregiving and to the Lifespan Respite Care Program. Now, without further ado, I would like to, unless anyone has any questions, let me see if, are there any questions in the chat box we should be addressing before we move on?
Nothing pressing, Jill.
Okay, great. Then let me introduce Lori Stalbaum, our Federal Project Officer for the Lifespan Respite Care Program at ACL. Welcome, Lori, and thanks so much for being with us today.
Thank you, Jill. Greetings, everyone. I'm really sorry we're not all in Wisconsin, because it's my home state, and I've spent many wonderful days in Madison, and it's a beautiful city. But right now, I'm just really grateful to Jill and all of her colleagues at Arch Respite for shifting gears so quickly and pulling us together for this online learning symposium. Jill is pretty amazing. And to you, Jill, I just want to say thank you so much. I'm really looking forward to these 2 days where we'll still be able to come together to listen, to learn, and connect. Oh, next, do I do the slides? Sorry, that's me. Welcome. Next slide, sorry. I'm a little rusty. So as I've only been working on this project for a short time, I thought I'd take a few minutes to introduce myself to those I haven't had the pleasure of meeting on one of Jill's training calls or COVID-19 calls. So I'd like to give a little background about my work history at ACL AOA and tell you about the passion that drives me to do what I do every day. So I joined what was then AOA as a presidential management intern, PMI, in 2001 after receiving my master's degree in social work. Not clinical, it was in management and community organization in the field of aging. As a PMI, you rotate through various positions within your home organization to learn multiple multifaceted things about where you're working and where you're going to be working. It's a 3-year program. So when I was a PMI, I worked for 6 months in our budget office. And there I had the opportunity to work on AOA's budget submission to Congress. I also had the pleasure and thrill of writing our Assistant Secretary's testimony to Congress about our budget request for the whatever fiscal year that would have been, 2002, I think, 3. It's been a long time, 18 years this September. After that, I actually had an even bigger honor. I was asked to serve as the special assistant to the Assistant Secretary for Aging, Josefina Carbonell, who was the Assistant Secretary under George W. Bush. She was just wonderful to work for, and she had so many great ideas, and she's the one who introduced the concept of the Aging and Disability Resource Centers, and as you all know, turned them into they've become quite a network, and I know all of you, every one of you partner with them. So that was a pretty amazing idea, and it's still going strong today. Following that, I was tasked to work with the project officer or program director of our Alzheimer's demonstration grants to states program. And this is when my passion to serve the elderly, which I discovered when I was 16, really flourished. A short time after stepping in to help, the project director left, and I was offered the permanent position of project director for the Alzheimer program. And I ran that program for 5.5 years, and still consider the work I was allowed to be a part of a highlight of my career, because the Alzheimer program, like Lifespan Respite, is not confined by age, it's confined by disease, but we worked on programs for people with Down syndrome who develop Alzheimer's at a much younger age, or early onset dementia, just minority and underserved populations, just all the great work that the grantees did in that program still warms my heart today. It was a wonderful experience. But in 2008, an opportunity arose for me to serve as what they called a program liaison across all of AOA. And so what that meant was that I worked in our business office, but I served as kind of a translator, if you will, and a Jill of all trades, and worked with all of the AOA program staff and program officers and our business offices, including the grants office, the contracts office, the budget office, and the IT shop. So it was the best of all worlds, because I learned about so many of AOA's programs and the statutes and the rules and the ideas and the innovations behind them, but also from the context of the business world and what it means to issue grants or contracts and things like that. So for me, it was pretty fun. And along the way, the person who was the director, he kind of moved up the ladder, and he took me with him. And I then became the special assistant to the deputy administrator for management and budget, which basically meant I got to do even more of what I was doing before, but it was more involved, and it was way more fun and so much more stimulating, because I was given a lot more responsibility and free reign, and I like free reign very much. But as time passed, I started to miss being directly engaged with grantees like you that were making things happen on the ground, you know, in the real world. It was fun doing the other work, but felt like it was time to get back to my roots. And last October, an opportunity arose to return to AOA and work for Greg Link, who maybe most, but not all of you know, is the original Lifespan Respite Project Officer, the one who started the program when Congress enacted the Lifespan Respite Care Act. And he asked that I was assigned to manage what they called the, quote, caregiver portfolio, end quote, of programs, which sounded awesome. I'm like, I'm in. And so I didn't hesitate. And while I've only been back at AOA, if you will, a short time, I've been with AOA ACL for almost 18 years. But I now have the honor of managing all of the Lifespan Respite Programs. Plus, I serve as the alternate designated federal official for both the RAISE Advisory Council and the Supporting Grandparents Raising Grandchildren Advisory Councils. And both councils are charged with submitting reports to Congress that discuss the status of caregiving. The RAISE is across lifespans, across the lifespan, across the caregiver age, across the care recipient need. And then Supporting Grandparents Raising Grandchildren is targeting kinship families and grand families, as they're called, older relatives or family members raising children. But not just a report of the status, but a report that includes recommendations and identifies gaps and things like that. And then also the RAISE Council is charged with developing a national family caregiving strategy, which is pretty darned exciting and an awful lot of work, but we have some really committed people on these councils and it's going extremely well. We're at the stage where we're finalizing our outlines for the reports to Congress, and we'll begin starting to write the report soon. And actually, I think it was, if it's June, I think it was just last month, May, it's all a little blurry, Jill gave a presentation at the RAISE Family Advisory Council meeting. And I'm sure you can imagine it was exceptional. It was truly wonderful, talking about the background, talking about the Lifespan Respite Program, talking about ways for the council to consider how we could improve the respite program, expand the respite program, the needs of, the importance of respite. It was an exceptional presentation, Jill, thank you. And last but not least, on a personal note, I just want to let you know that I have been a caregiver. When I was a young adult, my mother bravely fought and lost her battle for cancer in the early 80s. I lived at home with my father, and he and I took care of her. I've been a respite provider for my sister, who took care of my father when he fought and lost his battle with leukemia in the late 90s. And I am today a caregiver, a mother, to my 2 adult children, aged 23 and 28, who each live with different forms and levels of disability. So basically what I want you to know about me is that I've been at AOA, ACL a long time. I've had a variety of exceptional work opportunities here, and I am a caregiver. So both intellectually and emotionally, I value the work, I value the work that each and every one of you do every day to help every caregiver or care recipient live a more supported, fulfilling life. Just thank you for everything you do. Next slide. Sorry, next slide. Oh, thank you. So now, my role as a federal program officer. I actually love working for ACL, AOA. I love working for the government. And one of the things, my main guiding principle as your project officer, program officer, my main philosophy behind everything I do and all the work we do together is that as the federal project officer, my job is to ensure your success. So what do I mean by that? That means I am available to you anytime you want. Good news, obstacles, issues, questions, concerns, confusion, whatever. Please know you can always reach out to me, email or call. I really am here to help you. If you email me and you have questions, if we need to bring Jill in for the TA, I just want to make sure everyone succeeds. So if you're having no question is too small and no problem is too big. We're in this together, and I want to help make sure you succeed. So I hope you'll let me be a part of that in whatever way I can. Next slide. So respite in changing times, as Jill talked about. I mean, at this point, the pandemic has changed everything we know about how we work, live, stay connected. I know, I understand. I mean, we've all been put to the test. We even adapting the way we do meetings and the way we provide or try to provide respite services. And that's a big one. Oops, wrong page, sorry. No, wait, I lost my spot. Give me a minute. Thank you. Through by attending some of the COVID calls that Jill's run with those of you who are able to attend, I've heard about some of the really creative and innovative ways you're continuing to support caregivers and care recipients in your states. And it's just really amazing. I mean, these are difficult times, and people are just, we're being really forced to not just think outside the box, but to like put the box aside and pretend it never existed. And it's difficult, but symposiums like this will help us learn from each other and our own creativity. You know, just never know where it'll take you. So one of the things I want to make sure everyone's aware of because of the pandemic, and I want to just be very clear that each of you has increased flexibility because of the pandemic in how you work to serve your target populations. It's perfectly okay and understandable if you need to adapt the way you provide supports, or if you use trainings instead of direct, you know, meetings, or working with volunteers, if you create recordings of programs and just have to do things differently. Or if you have alternative respite options like care baskets, or, you know, weekly check-ins, or what is it, robotic pets that you provide. We have to find ways to adapt. The Department of Health and Human Services and our grants policy has given us authority to allow for adaptations to the original project plans. The goal is respite, the obstacle is the pandemic, and the solutions are in your expertise and creativity. And if you're not sure if something is okay, ask me. If you have a great idea and it works great, tell Jill, tell me, let's share it. Because it's only, you know, I know that we all learn from each other, and we'll all be better because we have each other in the background ready to support and learn from and help us whenever we need that extra lift or extra new idea. Like, I can't wait for Bring, Brag, Borrow. I'm going to learn so much, and I'm just very excited about it. It's just like, you know, my first chance to really get to learn about so many things all in one sitting. So I'm sorry, I'm just really excited. And these last few slides are what we call administrivia information, but they're very important, and so I shouldn't belittle them. If we could go to the next slide, please. Two things I want to talk about, carryover requests and no-cost extensions. So if you're not sure, what is a carryover request? Well, let's say you're in the second or third year of your project and you still have money left over from a previous year because we gave you the money in 3 one-year increments. Well, when you get your new award, the money from the previous year doesn't automatically come into the new year of funding that you received. If you have some money left over in your previous year of your project, you need to submit a request to carry over whatever unobligated, or unobligated means like it's not set aside for something specific, monies you have left over. So you carry the money over from the previous year to the current year. In some instances, you may not have done that already. So you may be in your third year, but you have a little bit of money in the first year of your project and the second year of your project, Well, you can still carry over money from the first year to the third year. It's okay, but what we need is for you to make sure all the money you have available to you is in your current project period budget. And when you do that, the carryover request, and you tell us how you want to use the money, like say you had trouble filling a position. So you had designated, $60,000 for personnel, but it took a little while to hire someone. So you had this $20,000 from last year that you didn't spend because the person wasn't hired till later. That's okay, because those things happen. Life comes at you fast, as they say. And so, but that $20,000, you'll want to move it from last year into this year, but you may not need it for personnel costs because the person's on staff and you had already budgeted for a 1 full year of a staff person. So in your carryover request, you could tell us, well, I have $20,000 left in, well, say year 2, but I'd like to carry it over into year 3, but we're going to put it into our respite vouchers and use it there, or into our training or into our outreach. And that's okay. So I just want to make sure people know that in a carryover request, it doesn't have to be carryover from line A to line A, because sometimes the reason you have the money left over is because of unexpected circumstances, and that's all right. So this next slide that I have, what of carryover requests, is very overfull and not appropriate for a presentation, in my opinion. However, I added this slide because I wanted to give everyone in one place through the course of this symposium. This is, if you were to request a carryover, this is everything that is all the information that ACL requires you to include with a carryover request. So I really put it here as a marker, or as for your information slide. I mean, you include a cover letter that has to be signed by the person that's designated as the authorized organizational representative that's listed on your federal notice of award. You explain to us why you have a carryover. It took us a while to hire someone, using my previous example. And so we have what money do you have left over? So we have $20,000 left over from last year. And we'd like to use the $20,000 for additional outreach, the activities that we're going to use to support. You have to provide a budget justification, which either I or many of you know Sherlonda Blue, who is my partner on this. And had we been in Wisconsin, I was hoping she'd come with us, but she's not available this week. So anyway, a budget justification. Sherlonda Blue is the grants management specialist for all of the Lifespan Respite Programs. And the budget justification narrative stuff is really her area of expertise. I can help. I know how to do it, but there's 2 of us who can help you with that. And then you include an annotated and what they call a federal financial report, which is referred to as a 425, that shows how much, just confirms how much money you have left over. And then you submit and this is more for your fiscal people, a report from what's called the payment management system that shows that the money is exactly matching your 425. So I just kind of went over it a little bit, and I'm sorry it's really busy, but I really wanted to put it on one slide. So if you need the information, it's all right there. If you have any questions about it, we can always address it later or anytime you like. As I said, I am available to you. And then the next slide, no cost extensions. So what is a no cost extension? No cost extensions are different than carryovers. No cost extensions are only done when you're coming to the end of your full project period. You've received your in the case, this isn't true for the new states. Well, the new states, if you're coming to the end of your project time, or with the advancing states, or as we're calling them this year, the state program enhancement grants, you're coming to you've received your last year of funding. You're in your last year to spend the money, which for most of you, is August 31st this year. A no-cost extension is done when the full project period is ending. And what that is at the end of your program period, you automatically have 90 days to complete any final work, pay all your bills, and close out your program. But if you think you're going to need more than 90 days to close out your program, maybe you have a training scheduled for, September 2nd, and you're working with a bunch of different people or something, and you're not sure that the bills are going to come in time because you've worked with that vendor before and they're notoriously slow, or whatever, or you have a bit of more money left over than you anticipated, because certainly through this pandemic, while people are spending their federal funds and their match funds, I suspect people are not spending at the same level as they would have if we were not under the current circumstances of the pandemic. So if you think you'll need more than 90 days to close out your program, you need to submit a request for a no-cost extension. No-cost extension requests should be submitted by August 1st this year. This is ACL requires that we receive 30 days notice, because we're basically going to extend your award for up to 12 more months, depending on what you ask for. And we will issue a new notice of award that shows you have the additional time. The maximum amount of time you can request with a no-cost extension is 12 months. So it would be perfectly fine for you to, if you don't think you can close out your program in 90 days, it would be perfectly fine for you to request a no-cost extension through August 31st, 2021, rather than 2020. I often tell people, since 12 months is the maximum, just go ahead and request 12 months. If you're done in 8, you're done in 8. If you're uncertain, if you've just got a few hanging chads out there and you'll be done in 5 months, that's fine. But don't stress over it. If you're not sure, let's talk, okay? With a no-cost extension, no additional funds are added or awarded. It's using the funds you have remaining in your balance as the program is coming to a close. So, excuse me. So, like a caregiver request, it's funds you haven't been able to use in the year they were designated. But because it's the end of your project period, it's called a no-cost extension, because we're going to extend the period of your project for an additional amount of time to allow you to finish the work you need to do and use the funds you have available. Both carryover and no-cost extension requests and the documentation all have to be submitted in grant solutions as what we call non-monetary amendments. They're called non-monetary amendments, even though there's money involved, because we're not giving you any new money. We're working with what you have. It's government ease, or federalese, as I used to call it in the Alzheimer's program days. I call that federalese. So there are, if you have questions about that when you're going to submit it, let me know. Let's talk. I'll try to help. And then next slide, the what and the how. And again, not quite as jam-packed because there's not quite as much information required. But this is letting you know, this is again my effort to let you know all in one place, all on one slide, what ACL requires when you submit a no-cost extension request. Again, if you're going to submit one, please do so by August 1st, which I think is maybe 6 weeks away, because I'm pretty sure it's June 16th today. Again, you'll need a cover letter. Again, it's signed by the authorized organizational representative. You identify a specific proposed end date, not to exceed 12 months, and you provide a justification of the money you have left and the work that will be done during the time that the project is extended. And just as a side note, if you plan to request a no-cost extension, but you realize you have still have some funds in your second year or first year that you never carried over or moved into the current year, you can submit a carryover request or requests and the no-cost extension request in one submission. You need to be sure the cover letter addresses everything. If it's easier for you to do them separately, that's fine. But if you wanted to do them in one fell swoop, you could write one cover letter that the AOR, authorized organizational representative, signs, and then you include all of the required documentation. Also, with just going back for a second, forgetting the no-cost extensions for a moment, say, well, this isn't really as applicable if you're in the third year, but let's pretend it's the beginning of the third year of your project and you want to carry over money, and you realize you have money to carry over from the first year of funding and the second year of funding. You can submit the request to carry over money from both year one and year two in one submission. Don't have to do, I want to move year one to year two. Okay, it's all in year two. Now I want to move year two to year three. You can say, here's my year one money, here's my year two money, and here's where I want it to go in my current year three money. And I hope it's a little heady, but these are, as we come to the end of the project periods, whether it's the full end of your program or the end of your second year, which for everyone is August 31st. This is just very important information I wanted to make sure you had before you. And again, the basics of what you need to know to submit the request. Next slide. So that was everything I could think of to cover today. I wanted to introduce myself, give you some background, and hold on a second. I see a chat question, but I'm not very good with that. Excuse me. I hope it's been helpful. I appreciate your time and having the opportunity to work with you.
Yeah.
And into the future. And at this point, I'd be happy, if there's time, Jill, I'd be happy to answer some questions. Because I know
thank you so much, Lori. That was a great presentation, and I just want to say how lucky we are to have you as our program officer. So I hope everyone will take advantage of this wonderful person who's given us so much information today and is so available to all of us to help us get through our grant processes. So thank you, and thank you so much. I will attempt, as I just did, to unmute all of you. So if you have questions you'd rather ask in person rather than typing them in, you can do so. You also, again, have the ability to mute and unmute yourself as well. So we do have one question here. Well, I think I'm going to keep muting everybody.
It's scheduled for a total of 29 hours this week. But Eli said if I take.
I do have one question here from Dina. She says, if you need a no-cost extension on original year 3 and on an administrative supplement award in year 3, do we need to send separate requests? She thinks they may need to be separate since the grant numbers are different.
Deanna, hi. You're absolutely right. The grant number is the key. If you had a supplement on an award and the grant numbers were the same, it would be one no-cost extension or request. But if you're year 3, if the award that is your original year 3 award and your administrative supplement has a different grant number, then those are 2 separate awards, and those would have to be 2 separate actions or requests.
Okay, she says thank you.
You're welcome.
From Peggy in Colorado, she has a question for you also. Do adaptations and alternative supports caused by COVID need to be approved prior to making the change in the grant work plan, such as robotic pets when not in the original grant?
Well, that's where creativity comes into play, because the goal of the program is to provide respite. It may have been that you had volunteers going into the home, but the volunteers are not able to go into the home due to high risk, due to the where you live. Like where I live, we're still in phase 1. We're a long ways off from getting out of our houses. So if you were to use robotic pets in lieu of volunteers, I think that could work. It's helpful for me to know the full work plan, but the general answer is yes. It's not really about approval. It's more about awareness. If I could, for me to have, because we have to keep official records, and we're also keeping records of things related to COVID and adaptations, like if people needed extra time to submit a semi-annual report because of the workload due to COVID, we have special codes we have to put in, administrative stuff. But because a robotic pet could actually serve the purpose of your original work plan. It's just a different means of meeting the goal of your original work plan. So there's like a nuance in there. So that's an answer, non-answer, Peggy. I would say you do not need approval, but I would appreciate awareness or just a chance to understand. You don't need approval. You need to provide respite, but we should, just talk for awareness so I can know. Because also, as Jill said, Administrator Robertson is very interested in this program, and I love to tell him about what people are doing. And some of you may or may not know that he was the State Unit on Aging Director in Oklahoma, in which state I understand they started their own state respite program before there was a Lifespan Respite Care Act. So this is very near and dear to his heart. So a lot of it is for my awareness more than my approval. Is that okay answer? Thank you, Peggy. I'm glad that was an okay answer. I don't want to be an obstacle. I just want to make sure we're all.
Start the day at.
I tried to unmute everyone in case anyone wants to ask a question. For those of you who don't have something to say, we'd appreciate you muting yourself. Does anyone have a question they would like to ask of Lori?
Hi, Lori. This is Arlene Evans-Orelli from the Virgin Islands.
Hi.
Can you hear me?
Yes, thank you.
Great. Great. I was
One
with
second.
the Zoom.
Yeah, that would be good.
All right, I'm going to try to mute the talkers.
I think Jill's trying to, yeah.
Hard to see who's talking.
That's great.
I'm going to ask everyone, please mute yourselves if you're not speaking. We'd really appreciate it so we don't have to mute everyone. Thank you.
Well, I will, yeah, it won't be difficult.
Go ahead, Marilyn, just speak up.
Yeah, Arlene.
Oh, I'm sorry, Arlene. I'm so sorry. I apologize.
That's quite all right. I kind of tuned in late because I was having such a hard time getting on. But
right now I'm on Zoom.
I didn't hear your talk from the very beginning. So is this just the CARES Act funds that you use for respite, or could you, in my case, use it for my block grant fund?
No, this is not CARES Act funding. This, the Lifespan Respite Care Act program was established by Congress in 2009. This is a specific program managed by AOA, overseen by me with a lot of help from Greg, because who wouldn't go to the expert if they were sitting across the hall from you? And this is an ongoing program. We've had We
Yeah.
fund grants. We just, last month, closed 3 funding opportunity announcements for applications for, if you've never received funding under this program, you could apply as a new state, which includes territories,
Okay.
to begin to develop a coalition. But this is an ongoing AOA program and is not.
Oh, okay.
What
Thank you.
What we're dealing with right now is because of the COVID, which has resulted in CARES Act funding.
Yes.
What we're dealing with is how to reach people and continue to serve people under circumstances that do not always lend themselves well to going into people's homes or having people come out.
Thank you for explaining that.
My pleasure. Any other questions?
This is Lisa Schneider in Wisconsin. Just curious, are we still on target for reviewing the applications that are in for grant funding and still looking at possibly an August to September start date?
I am still striving for an August 1 start date, despite the current grants having a September 1 start date. In the long term, my goal will be to move these grants to a July 1 start date so they align with the majority of the state's budget cycles, because I know from the Alzheimer program that for state government agencies that tends to be easier. We are in the midst of the objective merit review for all of the applications that were submitted, and we are still targeting an August 1 start date. But as we all know, it's been a year of adapting, changing, making goals, and resetting goals. So I cannot guarantee an 8/1 start date, but I am working as hard as I can to ensure an 8/1 start date.
Great, thanks, Lori.
Thank you, Lisa.
Thank you so much, Lori. I think in the interest of time, if you have additional questions for Lori, feel free to type them into the chat box, and we'll be taking a look at that over the day. I do want to start moving into the bring, brag, and borrow session because we have so many wonderful, and we don't want to keep Lori waiting anymore for this wonderful opportunity.
And thank you all so much.
We are really excited to bring this bring, brag, and borrow session to all of you. As we are every year, it's always the most popular part of our grantee meeting, so we thought that's what we should feature in this shortened virtual meeting. We're going to hear a lot about your significant accomplishments of your Lifespan Respite Grant or your coalition over the past year. Just to remind you, one person from each state was designated and reported to us, and they will have 5 minutes to present or share a video or other resource. We'll follow the order of presentations listed on the schedule, and you can see them for a few seconds up here on the slide as well. You should have all received that via email, the schedule for today. If not, you can pull it up in the link that you see there on the screen. And I will be sure to post that link in the chat box as well in a few minutes. You can also find all of the PowerPoint presentations that people will be sharing today. And if they've shared a document or a video link, you can find that also on the Arch website at that same link. We tried to group the presentations by the primary topic, but some of you had multiple topics or they overlapped into more than one topic, especially if you were also talking about how COVID-19 affected your planned respite activities. We do have a lot of PowerPoints and other links to bring up, so I hope that you'll all be patient with us if we run into a technology snafu. There were 2 or 3 of you who also, for some reason, had difficulty logging in today. You either didn't receive your link, and we apologize for that. Tonight, as we did on Monday, we'll be resending the links to all of you. Please check your spam and junk folders to see if the link is in there, and try to test it out in advance so that if you have a problem, we'll be able to deal with it before we get started tomorrow morning. I did want to let you know that if you go over your allotted time of 5 minutes, you may hear Susan ring her bells. I don't know if you're there, Susan. You can let us hear what the bells sound like.
I am. It sounds really loud to me, but it should be kind of gentle.
It's very Zen-like bells.
Okay, yeah, didn't want to really blast you out, but just kind of gently nudge you out.
Just to keep us on schedule. If you, as you're listening to your colleagues speak, please be sure to jot down any questions or comments you might have for them. Even on that little schedule I sent you, the last column has some space for you to jot down those questions. We will take a short break after everyone has finished, after we've gone through these 10 presentations, but then we'll come back to an Ask the Expert section where you will have a chance to ask your colleagues questions and share more of your own information. So let's, without further ado, we can proceed. The first topic that we're going to hear about today, we've grouped again the first 7 presentations into voucher respite. And we'll start off with Utah Ulrich from Arizona.
Good morning. This is Utah, and I'm going to talk about voucher, but actually also a lot about our adult day center program, because that's how we chose to kind of offer our voucher. So the Arizona Caregiver Coalition works with the Arizona Department of Economic Security to administer the Lifespan Respite Grant. And as I said, we chose to put a lot of funds in the Adult Day Health Center, but we also have a voucher. And as you can see, so through the Day Center program, we've served. Okay, can you hear me again?
Yes, we can hear you.
Okay. So we serve 245 families, over 15,000 hours of day center respite, and we see a lot of pros and cons. We had several reasons to not just do the voucher for in-home respite, but also use the day centers. Some of it was tracking of funding. We had some experience with mismanagement of funding for the respite voucher. And we can't do case management. And so we kind of chose the day center model for a number of reasons. And it served us very well, but we also found, some barriers. So I want to come back to the barriers too. From the family perspective, the day center, it can't really be a win-win scenario. So if there's anybody who is, not sure about using day centers or how that works, it's not only the caregiver that gets a break, but the care receiver who has the opportunity to leave the home and participate in activities. And so this is something we're hearing from a lot of caregivers, sort of that extra, benefit that the care receiver, gets to get out of the home, establish relationship, engage in activities. And yes, it doesn't work for everybody. We've had a few people, where they said after one visit, this is not for us, my loved one doesn't want to stay. That happens. But overall, the people who use it, it's truly a win-win for both. Okay. One of the goals, of course, as a day center respite or generally voucher respite is kind of, for us too, it was to find families who hadn't used respite before, who had never heard of a day center, and we're trying to convert them or turn them on to day centers. It does happen occasionally, but it is challenging because we actually got most of our referrals from the day centers. Okay, and so you can see there's some issues here with, the referrals and the day centers kind of probably profiting from this. And I'm saying this in a positive way. But that's not how we expected to receive referrals, okay? And also, it's less suitable for younger care receivers because it just turns out, at least in Arizona, that the licensed day centers are mostly for older adults, for individuals with memory issues. And so here, you can start seeing some of the first roadblocks we ran into. But overall, we still really are much in favor of the day center program, which is very much like the area agency program, of course, but we can fill, you know, some gaps in case there are wait lists. And there's the questions, how are day centers funded? So many are nonprofit organizations, and some are, you know, for-profit, but the area agencies pay for services, you know, Lifespan Respite pays for some, and then a number of people do private pay. Okay, so no, slide 2 is good. We can go to slide 2. This is just the feedback from a small sample. I think this was literally just the last couple of months, but we do use a standardized tool to get feedback. It was actually developed by a professor at the University of Arizona. And you see from the nice blue bars, 6 is the maximum. People are very, very happy with the respite services, right? I do want to point out the third question that you're seeing. How much did receiving respite services help you keep the care receiver living at home? And you see the mixed responses there, ranging from not at all to don't know or not sure. And then the orange line is somewhat. And so we can attribute these answers to people not really understanding what we're asking, and the caregivers not really connecting their respite experience with the potential ability to, you know, to be in a better position to keep their loved one at home, either because they themselves are in better health, you know, and they're less stressed, or that their care receiver, you know, benefits from it. So I found this wasn't, I'm not, you know, we're not doing anything with that question, but I think it's something we want to look at, because often the goal of respite overall is to keep people in their homes. Now, if we can look at slide 3, I'm probably down to my last minute, right? So here you see some program highlights. Left is the day center, right is the voucher. Okay, we have a lot of older, truly older adults. We have couples in their 90s. I'm sure you experienced that too. Many taking care of their spouses. Okay, some of the, again, barriers we ran into, because we're using licensed day centers working with the area agencies, there are so few. All of Arizona has 15, and 12 of those are in the central metropolitan area of Phoenix and surrounding cities. So some of our target groups, like rural areas, were left out, okay? I'm hearing the bell. So almost done. So keep that in mind in terms of the day centers, right? And somehow we didn't make that connection. Also reaching Native American and Hispanic families became a real issue. And of course, transportation is an issue. So those are some of the highlights. If you want to know more about, you know, some of the day center pros and cons, please contact me. I'd love to, you know, talk about it.
I apologize, I was on mute. We have our next speaker, Pam Eliason from Idaho.
Hello, everybody. Thanks for giving me an opportunity to speak today. I just wanted to say a couple of things. Thanks, Jill, for making this possible. And Lori, it's always a pleasure to see you and to work with you as well. We actually in Idaho had to regroup. We originally wanted to create a respite registry, and after a lot of research, we decided we needed to do something else. We also were not able to continue to contract with a not-for-profit organization that had a statewide reach that would offer a respite voucher program. The organization that we'd been working with conducted a strategic planning process and decided to go different direction. We don't have a statewide organization really that we can work with, but we actually do. It's our area agencies on aging. So we regrouped and we decided we would pilot in an area agency on aging our consumer directed respite program, which is a voucher program. And another thing that we did is we actually braided funding with our dementia grant, some state funds that we got for the first time last year, and our Lifespan Respite grant. And that finally made a positive funding package for one of the AAAs to be willing to join us in this effort. Long story short, now everybody wants to do it. So our pilot paid off. We're going to go statewide with a respite program. Hopefully we'll get a new grant and be able to produce a really good lifespan program as well. One of the things that our pilot program, which was our area agency on aging in Region 3 of our state, we have 6 area agencies on aging. They took this project on and they've just done an incredible job. I'm very proud of them. So they developed the voucher program from scratch. One of the outcomes of that is a manual, which I'd be happy to share. It's still in progress, but the caregivers are saying that it's so helpful that I thought it might be worth sharing. And it's possible that we borrowed things from your state, your program. So if it looks familiar, once we get it out there for use, you'll know why. Anyway, we're still testing. The pilot is underway until next September or next August. And we're just in the first 8 months, I guess, of practice. 2 things that we wanted to accomplish were to serve underserved populations, and especially rural communities. Our workforce issues are just tremendous. And that was, it's been exacerbated by the pandemic, of course. So caregivers being able to hire someone local that they know, or at least someone local, makes all the difference in the world. And I know I'm preaching to the choir. We're just working on taking our program to the next AAA. So next, and AAA, Area Agency on Aging. Next week, we will be taking the pilot and using all of the materials and all the learning to train another area agency on aging to be able to employ this same program. So we're very excited about that. One of my concerns is we have a very skilled coordinator that's hard to replicate in other areas. So I am trying to figure out ways to build into our requirements at the State Unit on Aging, Idaho Commission on Aging, for the AAAs, some sort of effort that really focuses on how important that program coordinator is. So soon to come, a respite manual, or a respite, consumer directed respite manual. If anybody's interested, be happy to share it.
Thank you very much, Pam. We appreciate that. And thank you also, Utah. I didn't get a chance to thank you for your presentation. And we now have James Davis from Mississippi. And he does not have anything to share, but he will be speaking with us. James, are you with us? You may have to unmute yourself. James? I'm having trouble. I can't seem to unmute him, and he may not be able to unmute himself, so I'm not sure what.
Can you hear me?
Yes, go ahead.
Okay. Okay. I was wondering what was going on. I was saying hello. Okay. Can you hear me?
Yes, we can. Please go ahead.
Okay. Thank you. Thank you. I'm sorry. It started staticky. Hello, everyone. Yes, I want to talk a little bit about our Mississippi Respite Voucher Program. So far, so good. It's a pilot testing program right now, so it's fairly new to us. And right now, some of the good things that we're doing with the program right now, I didn't know so many people wasn't aware of respite care that's offered here in the state of Mississippi. So one of the things that we decided to do, especially since COVID-19, we have to, you can't really do any physical meetups right now, especially not in large groups. So the idea came about social media blasts. And a lot of people are finding out through social media and other streams of social media as far as Facebook and different things like that. So we're getting the information out like that. And so that's really a big kicker right now. So we're happy about that. That's bringing in more applicants and more people are signing up for it. We're working closely with Dr. Spencer Blaylock with the Mississippi Family Caregivers Coalition. Great partners to have. They're actually bringing in more applicants as well. We teamed up with the AAAs in our state, and there's 10 of them, and all 10 on board. And we partnered with the MAC Center, and MAC stands for Mississippi Access to Care. And with their no wrong door policy, that is real good. So we receive applicants from that stream as well. Our goal is to assist families who are not receiving any form of respite care, which we found out that it's kind of a large number of them that's not receiving anything. And so, like I said, we're still testing it right now. Everything still is at the beginning stage, but it is going smoothly. And
Mom's plans on, so I can talk. Mom and I can talk after she's done talking.
Okay. I think I maybe got disconnected. I hear static, but
I hear you.
Jill, you're muted.
Okay.
I don't mind.
Please, if you're able to mute yourself, if you're not speaking, we'd really appreciate it. Thank you very much.
Okay,
Bottom left corner of your screen.
Okay. Well, and also we are taking data because we have an assessment. We have a caregiver assessment attached to our application. So we're keeping track of data after that. And then we're going to do follow-ups with some of the care recipients to see how has the respite helped you, and the need for it. And so we're working on that data right now. And that's pretty much all we have right now. But so far, everything is pretty smooth. It's just with COVID-19 right now, it slowed things down a bit, but we find innovative ways to kind of get around that, and it's still kind of flowing.
Great, thank you very much, James, for sharing that, and welcome to our network too. James is relatively new to our network, and we're glad to have him on board.
Thank you.
You're welcome. Next, we have Vicki Clear from the Montana Respite Coalition.
Hello, welcome to, greetings from Montana, I guess I should say. It's fairly nice here right now, so it's good to be with you all. We're going to talk about a little campaign we did with a referral letter. What happened was I was receiving a lot of applications that weren't really complete. And so I thought, well, maybe if I sent out some more information about how to exactly turn in the applications and what all was needed, that would help. Otherwise, the process took a little longer because I'd have to send letters back out or call people and ask for information. And that's kind of how this got started. We have over 130 referral sources now, which is really great. It's growing. During this time, a lot of our people that are calling are from agencies that are working with folks that know that they need a little help, and so they're calling and referring people, and the applications are definitely still coming in like crazy, so that is a good thing. So I made up this packet of information, and I started with a letter that you show here because I really wanted to thank the people for referring people to our voucher program. They're what it's all about. If we don't have them, you know, we don't have people applying a lot of it. So I wanted to thank them and kind of give them an update of how many people we had served and how the program was going so far. And then I wanted to just kind of go into the coalition and how that all worked. And if they were interested, they could join that. And we also have some videos on our YouTube Aging Horizons channel. So I gave them a place to go to that so they could learn a little bit more information if they didn't know much about the respite program. Also, then I went into, you know, what was needed. So there's a survey and income information that a lot of times gets missed. And so I wanted to remind them of that. So I just really highlighted everything, and I sent copies of stuff with it. Also, I wanted to let them know that we also have an Alzheimer's dementia voucher program. So that people can apply for that also, and just kind of show them the differences of the two. So I did talk about that in the letter also. We sent both applications out so they could see it, the surveys, business card, we have frequently asked questions for both of our voucher programs. So I sent those also. And then a business card, of course, so they could get a hold of me. And it was really kind of interesting. We sent out about 92. I think I sent out 92 packets. I got back maybe 4 that the address wasn't correct, but went over actually pretty well. And from the results of that, we got quite a few referrals that were from more agencies. I actually got a couple of requests to come and speak to them. I did one presentation over the phone for 2 agencies that were together. And that was really great to be able to talk to them and answer their questions. We went in person to another one and took all the information and just really explained how it worked. And it was amazing what a difference that made to them to understand the program and really know how to refer people and what it was all involved. They didn't know certain things about it because it's hard to, you know, cover everything. But so it worked out really great. It was an awesome thing. Because of it, now I have a packet, so when people do call and ask for information, I can just send them that packet. I can do it either by mail or online, and that is really nice, so you don't have to look for different stuff. You can just put that packet together and send it, so it works out really good. I also now have a database of all the referral sources that I can send out postcards for updates, different changes. If there's something changed in the application, I can send that to them too. A lot of people have called for brochures, so I've gotten brochures out to more places because of this. I think it's increased our collaboration a lot and the communication between the referral sources and myself. Seems like I talk to them more. They just are more familiar with me. I get to actually know them a little better when they call and ask questions or want to talk about the person they're going to refer and make sure they're qualified for it. It's also nice that they know about both of our respite vouchers and the difference between the two so that we can reach more people and they know how to refer them. We get a lot of referrals from the VA, so that's kind of a different source. The Medicaid waiver folks are now using us as a first respite source. There's like 3 different agencies that now, or programs, I should say, that are using Lifespan Respite as their respite agency first. So we get a lot of different things on that. It's just been really good to have everything in all one place, and I feel like we've just really increased our referrals even more, and just a great collaboration overall. I think that's it.
Thank you, Vicki. That was really interesting. I want everyone to know that we're getting lots of interest in the chat box for people's materials and sharing, and just be sure that you'll all be getting a copy of the chat after the meeting, and you'll also have an opportunity to talk to each other and ask questions of each other once we've gone through all the bring, brag, and borrow. So thank you all for your interest. Next, we've got Cheryl Donnell from Nevada.
Hello, everyone. Can you hear me okay? All right. My name is Cheryl Donnell, and I'm going to be sharing some information from our pilot program of self-directed respite in Nevada. So next slide. Thank you. Okay, so on this, we're just sharing some information about our experience. Like everyone, Nevada was impacted by the COVID-19. We saw providers shut down, limit their services to only essential services, of which respite services was not considered part of, or shift to other activities that would hopefully bring some relief. And some programs have been seriously impacted. They've lost income and may shut down permanently. We're a little worried about that. About 48% of our participants did not see any impact at all because they hired friends or family or close people that they felt could were limiting their risk of bringing germs into the household. A few vendors still continue to send workers out under strict service policies to mitigate risks. But about 46% of our participants did see some impacts to the respite services. 19% of those self-imposed. They suspended their respite services over COVID-19 fears. Another 26 had program closures. The respite workers had to go under self-quarantine, or impacts to their respite plans because events canceled, businesses had closures, travel restrictions, other reasons like that. So we fared okay. Some did say that our respite service is the only thing they were still receiving. We made repeated calls to our participants. That most were doing just fine. Any requests or referrals for supplies or equipment were handled through our state COVID-19 response teams. And then for those who had impacts, we were able to offer them 2 months worth of their respite funding allotment spread over the remaining months of their respite contract. And almost all of them accepted this offer and anticipate resuming their respite either this month or next. To re-engage caregivers, we were asking them to think creatively about how they could have respite. So respite through face-to-face interactions while on FaceTime, Skype, online formats, front porch distancing approaches. That we had one family that allowed for a guitar jamming session through doorways and windows to keep that distance. Families that would make an interior barrier or a plastic draping that created a separation around vulnerable family members so that they could still allow for visits and supervision. And so this created what we accepted as eyes-on respite relief. Eyes-on meaning that that approach was happening without any physical care. But while somebody was napping or watching TV or enjoying music or visiting, that was enough to provide a break. If more hands-on supports were needed, of course, CDC protocols for hand washing, PPEs, and the like would still be employed. But caregivers got to set the protocols they wanted followed to have those respite workers coming into their home. Next slide, please. Okay, now we're comparing our data from Respite RX to other data on caregivers. And while caregivers were increasingly aware of respite and other caregiver supports, they were still not accessing it. And 36% of our applicants said that they needed more choice and flexibility in the design of their respite before they could use it. And so we called that finding the respite fit. We use that life course respite portfolio to help find that fit in a person-centered planning process. 81% of our caregivers said that limited options for in-home care was a barrier. Respite work is not a full-time job, and vendors often had policies about minimum hours that they required, or they would not fill a service request if travel times were longer. It just wasn't worth it to them. So there were limits on the in-home options for caregivers. About 25% of caregivers were also looking for after hours care, especially on weekends. And 25% were looking for some emergency care options. The self-directed respite model was successful for those families who would not have otherwise been able to access respite, but it also helped us to highlight some new challenges. Self-direction is not enough on its own because families are so isolated and disconnected in their communities that they struggle to recruit someone to provide that respite help. So as we learn, families need significant support in connecting with worker resources for respite. We did what we could during our pilot program, but have some work to do on addressing this particular barrier. Another item of interest is portrayed in this chart. Our data shows that the demand for respite, that green line on the chart, begins to peak when assistance needed with the ADLs and IADLs is just starting to grow. That peak is about when 39% of a caregiver, or excuse me, a care recipient's ADLs, IADLs now require some assistance. And that's shown in the blue and red bars at the bottom of that chart. So caregivers felt the load of care much earlier than respite models tied to level of care criteria. And we hope that all respite services in Nevada will now start to reflect that new understanding. And we want to continue our work on infusing self-direction into our respite funding and program decisions across all funding sources. Expand what respite looks like, especially after COVID-19. Work on attracting and recruiting these part-time respite workers, and recognizing that caregiver stress and starting these respite options much earlier in a caregiving career. And so that was what we had prepared to share with you today. And so thank you very much for letting me participate and bring, brag, and borrow.
Thank you so much, Cheryl. So many great things going on in Nevada. We'll now turn to Alicia Blader in North Carolina.
All right. Well, happy to be here, enjoying the opportunity to see and hear from all of our great peers here. So in North Carolina, we have been running a, and I do have slides. I'm not sure if those are going to come up. It's the caregiver phone survey results. There we go. Thank you very much. I think Cassandra is doing that. We very much have enjoyed having a Lifespan Respite Voucher Program. We have done this for more than 5 years now in North Carolina. We change it slightly each year, but just to kind of improve the program as we go along. But one thing that we do try to do is at least every other year, we try to do a survey of our voucher participants so we can kind of learn from them and see how the program is working for them, things we need to modify. Just a little bit of background on the next slide. We dedicate approximately $100,000 annually to our Lifespan Respite Voucher Program. We fund some other respite pots of money and different things, but about $100,000 annually goes to this program. Caregivers are awarded one $500 voucher per year, and it is a consumer-directed voucher. So the caregiver is awarded that money, and they are able to locate and hire their own worker. We allow them to do that. We allow them to hire an agency. We allow them to hire an institution or adult day health or adult day care provider. They also can hire a known person that's not the primary caregiver and does not live in the home. We have some parameters of the kind of people that they can hire, but they are able to choose an individual if they so choose to do that. So one thing that we did for the voucher program in 2018-19 is we had identified in our work plan that we wanted to partner with the United Way 211 staff to provide follow-up calls with all caregivers who are awarded a Lifespan Respite Voucher Program. Now, United Way 211 has been an on and off partner for ours for several years. They are ones that have a call center staff. Typically in your states, if you're using 211, they are calling for things like emergency food pantries, shelter, homelessness, sometimes disaster relief, and also just our general information and assistance referral system across the state. And so United Way 211 is a partner for us. They make referrals to our voucher program, and we also utilize them to actually call each of the caregivers who were awarded a voucher. And in order, they had a questionnaire that we'd worked on together, and they provided the assistance, did the calls, took care of the data, data collection for us, and we ran it through our system. 85%, or about 183 out of 216 caregivers were contacted by phone via NC211. And of those 85% of those 183 caregivers, 79% of those reached were able to use their Lifespan Respite voucher. Like some of you, we do have situations where we award a voucher and they don't use any of it, or they return some of it just because circumstances change, their loved one passes away or is institutionalized, or goes into a facility, and they're not able to find a worker potentially. But we ask about hiring and locating a worker. So 96% said locating a worker was not at all difficult. 89% getting reimbursed for respite services was not at all difficult. That is something a little bit different that we do here in North Carolina, is that we reimburse the caregiver after they have shown proof of respite, and we have a timesheet, and there's an agreement that we provide that the caregiver and the worker that they hire signs together, and we collect that information. It is processed through our respite voucher contractor, which is an area agency on aging here in North Carolina. Even though our vouchers are lifespan, they are awarded to caregivers across the lifespan. And we have about 60% of recipients are taking care of an older adult, and about 40% are taking care of an adult or a child. 9% said that getting reimbursed was only slightly difficult. We continue to look for, checking that they're satisfied, that they're using the respite, that it's an easy program for them to administer themselves. One of the things that we have really focused on in North Carolina is this statement: I used my respite voucher to do something I enjoyed and felt that the respite time was time well spent. We have felt it was important throughout our services and years with the respite voucher program to help use the opportunity to educate caregivers that respite is for them. It is for caregiver restoration. They are given permission, and they actually are given a letter when they receive their award in the mail that, this is about time for them. And they have a planning sheet that they can try to, make a determination in advance what they want to do with that respite time. So I think that's something, we feel like it's a great teaching opportunity about respite and how this is a break for the caregiver. And we found that it's helpful, and caregivers still continue to let us know what they did with that respite voucher time, even independently when we don't request that information to come back. So next slide. So the type of respite used, probably not a surprise, even though we allow them to hire whoever they want. Only 18% in this particular voucher year, and this is typical of other years, used a home care agency or respite service or adult daycare or group respite. Most caregivers in North Carolina enjoy the opportunity to hire a known person. They might be hiring a neighbor. They might hire a cousin that lives in another state. They might come and, find someone in their faith community, find someone at a club that they're aware of. Or they might look at actually an individual post that has been posted by one of our organizations that posts people who are available for private duty care. 7 people specifically responded how they like being able to hire a known care provider. We like to ask them, what did respite allow you to do? I loved, reading this. It was very affirming to, read the entire report where we get all of the comments back, to find out what they use their respite time. Go on vacation for the first time in 4 years. They get to go to children's events, granddaughter's graduation, spending time with a spouse, making an other child's cheerleading game. I think that's so important when we have families that have a typically developing child and a non-typically developing child, that we are very inclusive of being able to help the entire family with being able to provide these services. Next slide, please. So one of the things that this particular survey really highlighted to me was comments from people that said this taught them that respite was important. This having an opportunity to use a one-time $500 voucher showed them that this was worth the effort, and it was something that they could incorporate in their life ongoing. I love this, went to the movies for the first time in 10 years. I think we can all appreciate that a little bit, even more so right now, being at home far more than we had planned. Family continued with the person they hired to come once a week, even after the voucher, as they now realize the importance of having that support. Another comment, he is keeping the woman he found because she is so helpful. A parent, she was grateful for respite care because the person she hired also took her daughter out and worked on life skills, such as how to act in a store. I think we all talk about the value that a worker, that bringing someone else into your situation can have for the benefit of your loved one as well. This next comment, he was grateful because he is now realizing that respite should be part of daily living, trying to incorporate it for the future. And another comment we get often, this also paved the way for his mother to get used to other people besides him and his brother. You know, something that's very important to be able to help caregivers realize this is a necessity, it's valuable. Respite is an important piece in their life, in their family situation, and it can be something that really enables them not only to stay in their caregiving role, but also increases and enriches their lives. I had noticed a couple of comments on here about the planning sheet that we used. I believe that still might be on the ARCH website, but if it's not, we can send that again and share that. We actually have a, planning to use your respite. It's a one-page sheet that was adapted with permission from some research that was done long ago by Gerald and Associates of University of Utah, I believe. And so we have worked on showing, helping caregivers to actually plan and tell them this is your time. You have permission to do something with that. And I also have the full survey and all of the comments that we can share as well that, like I said, I think it's really nice to read it. If any of you are wondering if the work that you're doing is valuable, spending, a little bit of time reading comments like this will certainly uplift you and help you know that what you're doing is incredibly important for others. So that's all I had.
That was a lot. Thank you so much. That was wonderful. So much great data. And we should talk at some point, maybe in the Ask the Expert section, about Dale Lund's research about effective use of respite time. So we'll talk a little bit about that later. Our next presenter is the last person in our voucher category, and I welcome Nick Slentz from Virginia. He doesn't have a screen share, but he's here to brag. So go ahead, Nick.
Thank you, Jill. It's a pleasure to be here with everybody today, even virtually, to get a lot of nice ideas about what everyone else has been doing in other states. Actually, a lot of this is going to sound kind of familiar because, like North Carolina, Virginia is also using a consumer-directed model, and we also directly reimburse caregivers. A lot of what I'm going to talk about today is just how Virginia had set up its respite voucher program and then how we kind of adjusted it to make it easier for caregivers to pursue in-home services during the pandemic. Originally, the Lifespan Respite Voucher Program allowed applicants to receive a 90-day period in which they could apply for a one-time $400 reimbursement for respite services of a provider of their choosing. A lot of people either had an agency or, a home care provider that they were already using and they wanted to extend the hours that they were using them for. Some people pursued a new in-home provider to come into the house to supplement extra hours. The majority of the people who decided to use the Lifespan Respite Voucher Program chose an informal caregiver that was usually a family member who lived outside of their home, or it was another member of their community. And depending on where they were in the state, that was some of their only options available to them, especially in southwestern Virginia. It's very rural and there's not a lot of services available versus, the Northern Virginia area outside of DC. A lot of people in that area actually chose short-term nursing facilities that had short-term stays for respite opportunities. And we've also tried to design the program to be a little bit more flexible with some non-traditional respite reimbursements. We've reimbursed summer camps for children with, autism or other special needs. We've actually paid for an overnight hotel stay for a child with a disability to kind of get away for the evening and go to the movies and go to the mall. We've also even reimbursed the cost of travel to essentially get a family member out of state to come and provide some respite. Specifically, we reimbursed, the gas costs associated with coming in from West Virginia, and we've also reimbursed a plane ticket to have somebody come in from Buffalo to stay a month with her sister to provide care for her child. Since the pandemic has set in, we've made some adjustments to the program itself to kind of get people a little bit more flexibility. Anyone who applied for the respite program after April 1st, we've essentially doubled the time allotted for them to pursue their reimbursement from 90 days to 6 months. We've also discussed if second wave comes, we will probably push out their reimbursement period until the end of the year, just to give them as much time as possible and as much flexibility as we can, so people can really benefit from a respite opportunity. Usually the program also, this grant period, we had designed it originally where you were only allowed a one-time benefit over the whole life of the grant, which was our 3-year period. But we have changed that to allow for one single reimbursement per household per calendar year. So that would allow caregivers to receive up to 3 total reimbursements over the lifetime of the grant. The other trend that I've really noticed since we began is just there was an initial reduction in the average amount of applications received for our program. That seems to be the trend across, states, where once the lockdown set in, everyone just kind of boarded up their houses and was just kind of waiting to see what happened. But we've actually been steadily increasing the amount of applications we've gotten since probably the end of April. I've doubled the amount of applications I've received since then. But everyone who's really passed through the program since the pandemic set in has chosen to use informal caregivers in their household. And some of the feedback I've gotten from them has really been, they've been trying to socially distance themselves from others, and this respite opportunity gives them the chance to hire someone that they already know, someone that they've already been exposed to within their house without having to bring in any outside providers. And giving them the flexibility to do that has really benefited them, or at least what I've heard back from them. But that's kind of all that I really had to brag about today. North Carolina did a really good job of actually explaining how our own program works here. So thank you for doing all the hard work.
Thank you, Nick. That was great. I love to hear what's going on in my own home state of Virginia, so thank you. We're now ready to move on to our next topic, which is caregiver education and outreach and the connection to the current pandemic. So we welcome our first presenter in this category, Tina Urich from the Illinois Respite Coalition. Welcome, Tina.
Oh, thank you. Thank you for having me, and I've learned so much. from all the other coalitions, and thank you too, Jill, for all you do. So in Illinois, the governor's stay-at-home order began March 20th. And on March 27th is when the Illinois Respite Coalition began the and created the quarantine questions. And our goal was really to reach out to all caregivers. And we actually had a statement that we sent out and posted on our Facebook. And it stated that the Illinois Respite Coalition, starting today, is beginning quarantine questions. Our goal is to create content during the work week that addresses caregiver needs, resource questions, and tips for maintaining strong social, emotional, and physical health. If you have questions, topics you would like to see discussed, or helpful hints of your own, please reach out. And we started with how we started to implement it was the accessible way to communicate through Facebook and Twitter. We conducted over 40 posts, and we did that 5 days a week. And we made sure that with those posts, we would have a question and we'd have a resource link. We were building partnerships too by sharing the content with out on our Facebook and Twitter and website. We did a lot of likes and sharing of our own. And, you know, one of our resources ended up being Special Rec, the Northwest Special Recreation in Illinois. And from just starting to like theirs and share ours, in a day we would get 1,000 hits. So word about us and questions and how we could help was growing. We also learned a lot and from what other coalitions were doing, and we made sure that we were sharing. This also allowed for messaging and comments, and we also made sure that we would answer all questions that came to us within a 24-hour time frame. We also tried to make sure that with our information, if we could have it available in other languages. So the majority was also available in Spanish. What we have here too is we also made available all of our quarantine questions, all 40 of them, and then our answers and then the links. So if anybody's interested in that. Next slide, please. So it kind of came to a natural end as we were beginning the next phase here in Illinois. We ended our quarantine questions and then started with a new post that you see to the right, which is navigating the new normal. So we made that shift, and what we wanted to do was line up with current events and then discussing the reopening, these unprecedented times, and changing resources. So we did posts about childcare facilities and openings and CDC requirements. What does that phase 3 in-person summer program look like to try to help families plan? And then what we were doing and we're starting to do more of is the motivational posts and acknowledging that caregivers are swamped with information, advice, and referrals. And we thought it was important to be a space for information and what we also call pick-me-ups. And there's one at the bottom right, you know, remember to take a breath, take a break, and remind yourself you're doing great. Our most recent post was breathe in, breathe out, give yourself the patience that you give to others. And through these motivational posts, as we are looking at these posts on a daily basis, it really is the motivational ones that we're reaching out more to the caregivers, where we were getting a lot more individual questions and also, you know, offers for some support. Next slide, please. So what we also decided to do is say thank you. And we wanted to say thank you to our families who have trusted us in providing respite during this unprecedented time. And then we also wanted to thank our heroes who, you know, make respite possible. So with those posts, we've also created others, which is just, you know, statewide, letting, you know, families know too that we're here for them and that, you know, let us help. And then with some of these other posts, we have a grant through the Department of Human Services and in-home grant for 19 counties. So it was also making sure that we, you know, continued, you know, to do the outreach for those programs. And I could tell you that through the in-home programs, even during the COVID time, they increased each month. And so we were really grateful that the families trusted us and our guidelines in following safe procedures to provide respite. So that's probably in 3 minutes, but that's just kind of a little update from Illinois.
Thank you very much, Tina.
Oh, you're welcome.
I'm really amazed at all you're doing in this area, all of you that have spoken so far. Next, we have Aida Stevens from Oklahoma.
Hi, Jill and everyone. Can you hear me good? Well, thank you all. And I'm going to set a timer because as you, I'm very passionate about helping family caregivers and have an amazing team here in Oklahoma to support family caregivers. And so I'm glad I have some slides, Jill, because as you know, I may carry on, but I'll do my best. So we actually have had some great events. Some have turned into annual events. And one is the Oklahoma Caregivers Conference. And we do have it in November, as you all know. That's our National Caregiver Month. And this last one that was held in 2019, we did get a proclamation declared for Oklahoma Family Caregiver Day. And we were so glad to help over 230 family caregivers. It was a very large event, and it was a day of both educating family caregivers about resources as well as the balance of self-care. And so it was, again, that I wanted to share just a few things that our family caregivers had to say, because it's just best in their words, really. So one of the lunch presentations that we had was actually a panel, and these were caregivers across the lifespan. So we intentionally sought family caregivers that either had a child, young adult, or older adult. And a lot of the feedback from that panel, lunch panel, was very positive. And some caregivers, I'll just read a few of these, really enjoyed sharing by caregivers at lunch. It was so informative and inspirational. The conference was very helpful for me. A lot of the programs I didn't know were available. This was great, especially liked self-care session. And lastly, need more conferences like this. So again, as you could see, the feedback was very positive. And just to move through to Royalty for a Day, this again was planned. It was actually held on Valentine's Day. The committee thought it was very important for family caregivers to also, again, have self-care, to find that balance. We did a lot of pampering sessions, which were, again, the feedback was great. And I've got to read this one. It said, I love the available information in English and Spanish. Chair massages could have been all day. So again, as you can tell, the feedback was very positive. And another one said, information we had, I never heard about. So again, we found a good balance of providing resource information that could help their family, as well as just those reminders of self-care, and really a priority was focused on respite. So next slide, please. So I have to brag on our community respite sib shops. We actually funded over 15. We had 4 that were pending, but because of the COVID-19 pandemic, they put those on hold. But just so you all are aware, the intent behind this was to increase capacity across our state, to really just increase awareness of our community partners and caregivers. So what has worked very well, sib shops, for those that are unaware, this is a research-based program that was started over 30 years by Don Meyer, and it is a curriculum-based peer-to-peer model to support siblings that have a brother or sister with special needs. We have found coupling that with respite truly gives that family caregiver a break. And so we are excited to continue that. Currently, they are on hold. Next slide. Let's see, I'm running out of time here. Okay, so our Oklahoma Caregiver Coalition, again, just to brag on them, we have over 150 partners, and I really want to share our respite committee. They coordinate across our statewide respite programs. They have really worked very well together to increase access to respite for family caregivers across the lifespan. And many of you probably do the same in your state. I wanted to just intentionally share that we do have active engagement from Veterans Administration, State Department of Mental Health, Developmental Disability Services, our Area Agency on Aging, Foster Care, Grandparents Raising Grandchildren, just to name a few of the programs that coordinate in our coalition. In response to COVID-19, real quickly, we have updated information on our website. We're constantly sharing information through social media. We've made adjustments on our individual voucher program. We increased the amount. We lifted the previous restriction. Caregivers can hire a 18-year or older adult living in their home. So yes, that can be a spouse as long as the primary family caregiver gets a break. And that can be an older sibling, a family member. So in response to COVID-19, we did lift that. And we also lifted our household income restriction. We've had some great virtual training events, just to point out the on-the-road perspectives, which have been very successful. And I just wanted to let you all know that we hope to continue those because the feedback has been very positive. And really, it's just set up in a way where we have our community programs give a presentation about their program so that family caregivers can see how that can benefit their family. So I know I'm out of time, but just want to thank you all for this opportunity and look forward to learning from everyone else.
Thank you very much. Tennessee, Megan Schwam with the Tennessee Respite Coalition does not have a screen share, but she will be bragging today.
Hi. Can you hear me okay?
Yes, perfectly.
Okay, I'm getting a message that says my internet connection is unstable. So just wanted to make sure. Hopefully it stays stable. So I just wanted to talk today a little bit about our program's response to COVID and what we've been doing. So prior to COVID, we at the Tennessee Respite Coalition essentially had 3 programs: our Respite Voucher Program, our Senior Companions Program, which is a program that is seniors volunteering in the community to provide respite for other seniors, and then our helpline. During the pandemic, or when the pandemic began, we saw a 53% decrease in voucher usage, and that was comparing the months of March, April, and May of 2020 to March, April, and May of 2019. So 53% decrease in voucher usage and a 45% increase in helpline calls. So we've had a huge increase in helpline calls, just people looking for resources, looking for help, and mostly just looking to talk. What we found is a lot of our clients just really need someone to vent to right now. And then also during this time, our Senior Companions program halted completely, although we are beginning to return back to work. And so in an effort to figure out what we wanted or needed to do to adjust our services to meet the needs of our clients, we did a few different things. We surveyed our clients using SurveyMonkey, and so we serve a little over 600 clients a year, 600 caregivers a year, and we sent a survey out to them with a variety of questions. Lots of them were, fill in the blank, what are some lists of things that you need? But some of the data from that survey, we found that 35% of our clients felt that they were supported and had enough support and their needs were being met during the pandemic. But 60% of our clients felt that they were, and so many of the questions were related to what we as an agency can do to better support folks at this time. And so some of the things that came out of that sort of repeated a lot were, they really were feeling like they didn't have anywhere to go for respite. And so we're looking for helps with things like camps and like online classes and camps so that they could, put the person they're caring for. I'm sorry, what was that? 60% of clients said that they needed more support, Cheryl, is what they were saying, that 60% of our clients felt that they were stressed out during the pandemic and needed more support. So folks were asking for things in the home to help for the care recipients, things to help keep them busy. So things like puzzles, games. There were a couple people that were asking for things like trampoline because their kids with sensory issues needed some way to sort of deal with those sensory things. People were talking about, I mentioned online camps and classes, and then lots of requests for things to help caregivers just with general relaxation for themselves. And actually one of the questions on the survey stemmed from other conversations we were having with caregivers about care packages. And so things that people were asking for themselves were things like face masks, postcards of encouragement, crossword puzzles, gift cards to restaurants. We had lots of clients saying that they were struggling with food insecurity during the pandemic. So meal vouchers, coupons for grocery stores or restaurants, which, isn't something typically that we provide as a respite service, but, we had lots of conversations amongst our staff. Most of us are caregivers and, talking about, having someone provide a meal would really help with our stress level. And so that's something we've been taking into account. And then one of the other questions on the survey was how could our organization help you with mental health and self-care? And lots of those responses related to just having someone to talk to and vent to. And some requests for virtual babysitters, and sending postcards and words of encouragement over email. So that was one of the surveys that we did. And then the other thing that we did is our respite voucher coordinator has begun, I guess 2 months ago, began holding Zoom calls 3 times a week that any of our caregivers can get on. And so part of it is just a way to connect to other caregivers and to lend support. And the other part has been sort of collecting data from them about what sorts of things they need. And the things that have sort of risen to the top, again, were very similar to what we got in the SurveyMonkey data, help with food and groceries, Spa products is something that's been asked for a lot. Games, inspiring books, those sorts of things. And then we also have spent quite a bit of time looking at the data that Arch has been providing to us on, you know, what people are doing or what other agencies are doing and what clients are needing. And so looking at that. And so the programming that we have done in response to the pandemic has been sort of multifaceted. One I already mentioned, so the weekly Zoom calls, and this has been a really big deal for clients. I've got a quote from a client. I don't know how many people have told you this, but thank you for doing these video calls. We really appreciate it. I've been gardening a lot because it's the only break I get since we're not having any respite providers come inside the home to care for mom. The other night I planted okra in the dark and I was too tired to water it afterwards. So I was happy it rained the next day and really happy to talk to you. So people, we've gotten lots of really good feedback and actually have made the decision that even beyond the pandemic, we will continue to have weekly Zoom calls so that our caregivers can connect with each other and connect with our staff, and we can continue to provide resources in this new way. We also have set up Facebook call rooms. So you can do call rooms on Facebook where people can also call into Facebook. And so we've been doing that. We've been doing phone calls, so weekly phone calls to all our caregivers, which, as you might imagine, with 600 people is a lot. And so it's been sort of all hands on deck checking in. And some people are like, you don't need to call me anymore. And other people want to talk for hours about, you know, how stressed they're feeling. So, so that's been an important component. And then lots of emails to clients as well, just checking in. Another thing that we've done is provide a lot of different resources for caregivers. So we have a question, what age are your caregivers? So our caregivers range from about 20 to, we've got a caregiver who's 80. So wide range of caregiver ages. So we created some online resources for caregivers. One of the first things we did when the pandemic began was creating an e-care package. So we had been talking about care packages and needing to figure out funding for that. But in the interim, came up with these online care packages that we have been sending to clients and putting on our website and putting on our Facebook page. And it includes a lot of resources. So things like podcasts about caregiving and self-care ideas, but then also things that are just self-care activities. So things like adult coloring book pages. So things that people can just do in that 5-minute break they might find somewhere to help with self-care. So there's quizzes, podcasts, coloring pages, habit trackers, self-care ideas and tools, journal prompts, activity books, gratitude journals. We also created a list, our respite voucher coordinator spent a lot of time compiling a list of free online activities that caregivers can do, but also things that their care recipients can do as well. And so have been sharing that with clients and they've been very happy about that. Our respite voucher coordinator also made a Spotify playlist for caregivers. So just some like uplifting music. We also have our agency has a podcast playlist that we created for caregivers in response to the pandemic. We have also a private caregiver Facebook support group that we created in response to the pandemic. And so it's just a space that caregivers can come and really share ideas and vent to each other. And then we provide lots and lots of resources every day on there and lots of conversation prompts to get people talking. We also created a caregiver mentorship program where we're matching caregivers across the state. And so they are working together to give each other support and also ideas and suggestions for ways to help care for themselves and care for their loved ones during the pandemic. And then the other resource that we created was a list of possible respite alternatives for all ages. So we really started coming up with lists of online classes and camps and things like that folks can use. And so we we created those. So another quote from a client: "The only break I get is when my daughter is asleep. That's why I'm so excited about getting approved for virtual summer camp. I like to plant trees and I was worried about food when coronavirus hit. So I planted a huge garden. Can I show it to you? I'm so excited for online summer camp." So those are sort of the resource things that we did. And then in terms of actual programming, we've got 3 new programs that we've started, and not all of this is with Lifespan funding. We're still working with the Tennessee Commission on Aging and Disability to get approval to do these things with Lifespan funding, but we've been able to get quite a bit of emergency COVID funding that we've been using actually to support our clients who get respite through the Lifespan respite voucher. So one of the things we're doing are care packages. We have created care packages that are cost about $100 a piece, and they contain a bunch of things to support caregivers during this time. Lots of things focused on self-help and wellness. So we have like a Brene Brown book, adult coloring book and coloring pencils. I think there's some tea. So just a variety of things to give them support. And that the care package idea came directly from the caregivers that we were talking to. And the items in the care packages were all directly from caregiver requests. The other thing that we've begun are mini grants. And so we secured some funding, about 25 to create these mini grants where caregivers can request up to $300 worth of funding to purchase something to help them with their own self-care and to give them their own break of their choosing during the pandemic. So it can be things like exercise equipment, magazine subscriptions, movie subscriptions, a variety of things. And we've just started collecting applications for those mini grants, and so people have lots of creative, fun ideas. And so we're really excited to get going with giving out that money and getting those things for people. The other thing that we've done is also with that $25,000 funding is purchased a bunch of tablets. The research that I'm sure you've all seen that Jill sent out to us talked about caregivers, struggling with technology during the pandemic. And that's certainly something that we heard from clients as well, especially in rural Tennessee, that they may have access to internet, but their kids are doing school online and they only have one device and they're trying to share that. And so we have purchased, I think 200 tablets that we are giving out to caregivers across the state so that they can access online resources and, be a part of our online groups and, continue to just connect with us and other caregivers virtually. And then finally, the one other thing that we've done in response to client surveys is we have purchased a bunch of PPE and are passing that out to caregivers across the state. As it becomes available, we've sort of been purchasing and getting it to folks so that they have that when they're ready for respite providers to come back into their homes. We have some people who are bringing respite providers in still, and we just want to make sure that they're protected, and families are wanting to make sure they've got that on hand when they are able to bring folks in. So we've also used some of our emergency respite or emergency COVID funding to purchase a lot of PPE. And so that's where we are right now. We still, my staff are meeting 2 or 3 times a week to, what else can we do? How else can we respond to clients? What else can we do to support them? And so I'm sure we will continue to add to the list, but that's sort of what we're doing right now.
Well, thank you so much, Megan. There were so many wonderful activities there, and if you could share your notes so we have that wonderful list of activities that you mentioned, it would be really wonderful if we could post that on the Arch website.
Yeah, I can do that. And actually, there are a bunch of links in here, so people can click on the links and it'll give you a list of what's in our care packages or what's in those resources. So I will send that to you, Jill.
That would be so helpful. Thank you.
Mm-hmm.
Well, thank you very much to all of these wonderful presenters and sharing so many incredible activities. My only sadness is that it's just us, the grantees and partners on this call. I wish the whole entire rest of our respite network could hear about all the wonderful things that you're doing, but we'll make sure that we spread the word and we share the materials and resources that you've so generously shared with us. So thank you all very, very much. We are about 15 minutes behind, 15 or 20 minutes behind our timing on our agenda, but I still would like to take a moment to share this last question with you as we take a break. Let me get it up on the screen. We still will take a break. I think we'll shorten it to about 10 minutes instead of 15 minutes. So feel free to get up, stretch, get a glass of water or a cup of tea. And think about this question during the break too. And when you come back, maybe jot down a few things. We've already heard so much from our presenters about how they're planning for future services based on how things have changed so dramatically because of COVID-19. But if any of you have additional thoughts, please feel free to jot them down in the chat box. And when we come back, we'll have our Ask the Expert session when you'll have a chance to ask directly of our presenters if you want materials, if you want to follow up on something important they've said. Please take a few minutes to formulate your questions for that. And when we come back in 10 minutes, that will be at I think we'll come back at 3:25 and get started again. We'll entertain all of your questions and comments and discussion. So thank you all very much, and we'll see you in a few minutes. And please come back. Importantly, we want to see you again.
Jill?
Yes.
Sorry to bother you.
No, it's okay.
I think I have to modify my response to Deanna about the grant number.
Oh, Dina? Yeah.
What is it?
Her name's Dina.
Dina? Oh, I'm sorry. I put the emphasis on the wrong space.
Okay.
She
I
doesn't
can
have.
send you her email address if you want.
Okay, I didn't know if it might apply to others because she does not have different grant numbers.
Oh yeah, probably does. There, I think almost everybody got that supplemental. So.
Right, but the supplementals were issued to the existing grant award.
Right.
But what confuses people, there's like you have a 2-letter code, but they all have 4-letter codes. So it's like 90 LRLI 0012.
Well, you know what? I'll give you a minute to talk about this because they're probably all hearing you now anyway.
Okay.
There's one thing I'm sorry. It's one thing I have to do for my mother and her dog.
No, I'm sorry. It just suddenly hit me while I was walking, stretching my legs there, and I'm like, oh shoot! I think I answered correctly, but incorrectly.
Okay, I'll give you a minute when we come back. Give me 1 second.
Sorry about that.
No problem at all. No problem.
Thank you.
Welcome back, everybody. I hope most of you are back. I hope you had a nice break. That was so much to take in during those wonderful bring, brag, and borrow sessions. My mind is just exploding with all of the great new ideas. So, and there are lots of questions and comments that came in on the chat box. But we'd really like to open it up to all of you now. If you'd like to ask those questions or ask for materials directly to the folks who presented or of each other, we're going to open it up right now. This is Ask the Experts, and that means ask all of you who are the experts. So I turn it over to anyone who might have a question. If not, we'll go back and read some of these from the chat box. Anybody want to kick off? Questions, comments?
Jill.
Oh, sorry, go ahead.
Hi, Jill. It's Aita. It was a question, I believe, for Megan. Did you have a criteria to determine eligibility to receive an iPad?
Sorry. No, we just had an application form. We have an application form and people will apply and basically do something similar like they are due to apply for any of our grants, which is provide proof of diagnosis. And that can simply be a letter from a doctor or, you know, an IEP or whatever. So they present proof of diagnosis, fill out the 1-page form, and then we send them an iPad.
Thank you.
Not an iPad, sorry, not an iPad. It's a much cheaper tablet than an iPad.
Oh, okay. Thank you.
Megan, this is Susan Summers. There was a question in the chat box about the your caregivers conference. Whoops. Actually, I think that's for Aida Stevens. It was the 2020 Caregivers Conference. How if and how are you going to do that?
Yes, we are discussing virtual. We're quite prepared that we'll need to do that. Which again, from the feedback that we've received from the virtual trainings we've been offering, has been very positive. Transportation is a barrier for many of our families. So offering the virtual conference platform, we think has been very good for them.
So I just have a related question to that. This is Susan again. How do you support caregivers in attending? You have such great attendance.
Well, the numbers, we had 2 slides. The caregiver conference that was on the first slide, I believe, it was very well attended. The first statewide virtual conference, again, it was well attended. And we think really it's utilizing social media, requesting our partners to promote. And again, during this pandemic, family caregivers really more than ever are dealing with social isolation. And so we just feel like the timing was good and it's been very positive. It's interesting that so many family caregivers are unaware of just essential resources like respite. And so we're committed to continuing to provide a multifaceted approach so that we can reach these family caregivers. And so again, I think it's just in partnership with other community programs and utilizing social media and our website to just try to reach them.
Thank you.
I want to pause just for a second before we go on. Lori did want 1 second to clarify something she said earlier about the carryovers and no-cost extension. So go ahead, Lori.
Thanks, Jill. Dina earlier asked about carryovers and no-cost extensions if the grant numbers are different. And I got thinking about that. And generally, when we supplement a grant, we do not issue a new grant award number. So I thought about it and I went to double check. And Dina, as far as I can tell, and this would apply to the rest of you, your supplement was issued under the same grant award number as your original award. The grant award number is really a 10-character code, which starts with the numbers 90 and then has 4 letters, which depending on which funding you received would either be LR, LI, or LR, LR, and then 4 digits like 0012. That is the grant number. What you may notice on your notices of award or in grant solutions that after that 10-character code, there's a dash, a two digits, a dash, and 2 more digits. So looking at New York's award, in the 3rd year, it shows the grant number, the 10 characters, then it says -03-00. The -03 stands for the 3rd year of the project. The -00 means this is the initial award for that project in the 3rd year. When the supplement was issued, it says -03-01. That means that was the first change to that main 10 character grant number in the 3rd year of the project. So you don't want to pay attention to the things after the dashes when you're thinking about your grant number. You want to focus on if the 10 character code, 90LR-LI-0001 remains constant, that is your grant number, and then a carryover and no cost extension could be requested for the supplement all in one. And in the case of Dina in New York, that's how it would work. They were all issued under one grant award number. It's the dashes that might make it confusing. I hope that didn't make it more confusing, but it totally changes my answer, and I wanted to make sure I clarified that. And if you have any questions, I'm available. Thank you, Jill.
Thank you,
Sorry.
Lori. Dina said that was clarifying, so thank you. I think Yuto, are you about to ask a question?
Yeah, I'd like to. So this is Utah in Arizona. How is, really for everybody who has an answer, how are you coordinating all these activities with other organizations? So Arizona has a lot going on. All the day centers have online programming, AARP has programming, volunteer organizations have programming. I've had caregivers tell me, I don't need to know about your offerings because I'm already doing so many things online, I'm getting tired of Zoom. So how are you all coordinating?
Good question. Anyone have a response?
Hi, Uta. I know at ACL, we're, the same groups, just at the national level are doing things, and we're often in conversation with them about partnering on one of their topics or being a part of, if they're going to be doing a future, instead of trying to bring people to our own, we go to their program and say, we would like to talk to people about this. May we be a part of one of your programs in the future? And then we work together to get the appropriate people on their program instead of creating a separate vehicle. We latch on to what's existing. I'm sure with all the great work you've done in Arizona, I'm sure you know a lot of these people, the people who are doing these things. So, or you may even see if a group, multiples of the groups want to get together and do like a round robin session that brings more diversity to the topics for the caregivers to listen to from at one point in one time or something. But that's like at the federal level, that's even what we're doing, because it can be overload on our networks and our communities.
Anyone else want to respond to that?
Jill, this is Robin in Oklahoma, and I just wanted to mention that when we do our speed sharing on the road events, we have started dividing it by age so that a caregiver that may not be interested in caregiving services for children, but only for adults, we promote that, let's say the morning session is for caregivers of children, and then in the afternoon, caregivers of adults. That way you're not on there the whole time just waiting for maybe one resource or a couple resources. And then we also had a Spanish speaking on the road so that anyone that felt more comfortable hearing it all translated, we did a separate one just for that as well. So I think that gives a little bit of caregiver fatigue, Zoom fatigue, a chance to let them zero in on what they would really like to hear.
I would think also too that for many of these coalitions or lifespan programs that are running specific direct service delivery programs, many of these caregivers, for them, these folks are their only connection. And so it might be the first place they turn to for resources and information, even though there's so much else out there. But that's just my guess. Any other questions or comments?
Jill, just to follow up on what you said, that's what we think we learned from the COVID study with the break exchange, that it looks like respite is kind of the first and maybe closest contact for families. And so we would have just been so kind of overwhelmed with the strong connections that have come about because of respite. And sort of related to that, when I first came to work for Arch, Jill really had a hard time helping me grasp the difference between lifespan respite systems at the state level and individual programs. And so I think when COVID started, I expected to see a lot of distance between like coalitions and grantees and families. And I'm just so pleasantly surprised and impressed by those states that really know what's going on and are really in touch with families. And I think that comes about from some of the surveys that you've done and the caregiver directed voucher programs. And you know, like Tennessee could just write a book right now on what to do. So I don't know if anybody wants to talk about that, how it is you decrease the distance between administrating a statewide program and making sure that families are getting what they need locally. Like how do you know what to do locally?
I think for us, it really was just gathering information, right? Like talking to the caregivers and looking at the research and talking. We also talk with other providers and, you know, I sit on several different boards and coalitions, and, you know, they all seem to be doing their own research too. And so really just, you know, looking at that to determine what folks need at the local level. And, you know, that might look different in different parts of the state. You know, we're in Nashville, which is very different than rural Tennessee. And so, you know, I mean, certainly I talked about the tablets. There's definitely more of a need for those in rural Tennessee than there is here in Nashville. And so just listening to the people that we're serving to see what they need.
So just related to that, did you have data collection systems already set up, or people just kind of got busy right away?
We just got busy right away. I mean, we collect data all the time through client surveys. So it's not, I mean, it wasn't like something new, but certainly this was a different survey than we've ever done before. And I think, you know, the piece of this that was different for us was collecting data over Zoom calls and, you know, over Facebook. And so collecting data in ways that we normally wouldn't. And that actually, I think, worked out so well because not only were we collecting data, we were offering support to caregivers at the same time. And so it ended up turning into something much larger and much better than we anticipated. But so that was really the only change in how we were collecting data. You know, we use SurveyMonkey to collect information all the time. And so just used that again and developed questions. The Zoom calls started before we did the actual survey. And so we were able to use some of the things that we were hearing in those Zoom calls to sort of guide the questions we used in our survey or our assessment. And then also, you know, we're looking at what other agencies were doing, you know, both, you know, through break exchange and what they were saying, but also looking at other other nonprofits in our community and how they were responding. And we have a coalition on aging here, and they had just finished this really great study right before we did ours, where they were looking at where are the gaps in services right now for older adults during COVID. And so that really informed a lot of what we were trying to do as well, and informed our survey too.
Anyone else want to address this train of thought? We have lots of other questions in the chat box as well. Okay, I'm gonna look back on the chat box then, and there was a question that came in during Utah's presentation. Pam from Idaho would like to know how the Arizona adult day centers are funded.
I addressed that briefly, but the day centers have to be basically self-sufficient. So we only have 15 licensed day centers, and they are contracted with the area agencies on aging. And I believe that's a large income source. Also the state Medicaid program. They do have some private pay individuals, right? So one thing we want to do in Arizona is also explore non-licensed day programs. You know, we'll have to come up with a whole process to kind of vet them and maybe, you know, look at how they're run, make sure there truly are activities like in a day center, and it's not just like a room where people go and are left to their own devices. But I think the cost, because they are, you know, they have to be paid by the attendees or by programs like our Lifespan Respite or the area agency. That is one reason why a lot of people don't do the private pay, why they don't continue. So a typical cost for an 8-hour day is, I want to say, between $70 and $100, including lunch.
Thank you for clarifying that. And while I have Pam's ear, I want her to know there were lots of requests for your manual. So we look forward to getting that and posting it on the website as well. I have a question here for Vicki from Montana. Marilyn from Idaho is interested in the list of your referral resources. Are you still with us, Vicki from Montana?
Oh, I am. That's no problem. I can do that. I did a spreadsheet, and I can sure send it out.
I think, Vicki, you also had some other materials that were in your referral packet in addition to that letter.
I did.
Did you send those to me?
No, I didn't, because I didn't think you needed to put them up, but I can sure send them to you to, you know, put on the website.
If they're updates from what you've shared before, I think that would be wonderful, if you don't mind.
Okay. Yeah, and we'll have some more stuff coming up, so looks good.
That's great, thank you. And then we had a lot of comments when Alicia was talking about planning your respite time and the sheet that they use to help family caregivers plan their respite time. For those of you who have been with us from the beginning, way back in 2009, 2010, one of the earliest webinars we did was with Dr. Dale Lund, who's done some amazing work on what is it that really makes respite effective. And what he learned from his research was that even more than the care that was provided to the care recipient was what it was the caregiver did with his or her respite time. Was it something that was really meaningful to them so that they could get a true break? And that webinar is still up online, and I know that Alicia worked with him to develop the planning form, and I think several other states, Tennessee was using a planning document at one time. The Life Course respite tools can also be used as a great helping to plan your respite time document, but I'll let Alicia talk a little bit more about that if she'd like to. Alicia, do you have anything else to say about your planning document, planning tool?
Yeah, I think you captured it well. And I think, you know, it's one page. So as Jill mentioned, we got permission to kind of just take the highlights from his studies and make sure that we were clarifying. It has examples, it's a questionnaire. It has a little paragraph at the beginning, and then we have the caregiver think about what was it you used to enjoy doing before you were a caregiver? What were things that brought you a restorative break? It just is about 5 lines on a piece of paper that we don't require caregivers give us back, but it tries to have them think through the process of what is it that you would like to do with this time? And when you plan about it in advance, then people are more willing to give themselves permission to take that break. You know, back when we could go to a movie, we would have to have, you know, plans for, well, when does that movie start? Where am I going to go? And a lot of times in Dr. Lund's research, he found that caregivers would reply and say that they just, they ran errands, or they took a nap, or they cleaned a part of their house because they really hadn't thought about what they could have done instead. And so then after the fact, they ended up feeling a little more discouraged because they felt like they'd been given time and then they wasted it. And so that was sort of the impetus for us having this planning tool in advance to help caregivers understand that, you know, being able to really utilize your time, you might need to think about what you want to do in advance. So we have that tool that we include with all of our awards. We also did a campaign for a while where we had PowerPoint presentations that we developed on that topic, and we let all of our area agency on aging, family caregiver specialists, and respite providers and others actually use those slides, so that whether it was me presenting it or someone from our team or someone across the network, that they had access to that educational material so they could also go out and talk about that at caregiver conferences.
So Alicia, does every caregiver who comes to you for a voucher program, do they participate in that planning?
They all are given with their voucher award packet. They are all given this planning tool, but we don't now do kind of a one-on-one. We don't ask them to send it back. So it is definitely something that a caregiver can choose to use, or they can choose not to use it. We had done early on, we did a study where we asked all caregivers, we had a pre-survey, we had a post-survey, anyone who used it. There were definitely a small group of people that said they weren't planners, they didn't like it, you know, that wasn't their thing to kind of write that down. But for the caregivers who used the tool, we found that there was actually an increased reduction of burden for people who used the tool and then did actually something that they had planned to do during that respite time. So there was a direct correlation in reduction of burden in our pre and post surveys from caregivers who used the tool.
Jill, can I chime in there?
Thank you.
I just posted in the chat box a link to that original webinar way back in 2010, I think, Making Respite More Effective. And it was a wonderful webinar for those of you who are interested. And I think Cheryl in Nevada, I think they're using the Life Course tools to help do planning as well. Is that correct, Cheryl?
Yeah, that's correct. That's what we're using. We do have a post, pre and a post survey, and wish that we had incorporated some of those Life Course questions in the pre and post, but we're at least are catching some of that data now.
Yeah.
I don't know if my mic is live.
Yes, we can hear you.
It is okay. Thanks. Yeah, I'd like to just jump in here a little bit because I'm really, one of the things that I do with Jill and the Resource Center is to help advance the research and evaluation agenda to try to build an evidence base for respite. And I think most of you are probably aware of that branch of activity. And I'm really excited to hear the general interest in trying to understand and learn how caregivers use their time. It's one of the things that is of most interest to people outside of the respite community when you're trying to explain what respite is and describe its value. It's the kind of information that's probably among the easiest to get if if the right questions are asked. But like so many things in research and in the service delivery field, it's important to be sensitive to how those questions are asked. So for example, the idea of including a sheet that has a list of questions, and if people want to use it as a planning tool, and if they want to share the information, they can. That's great. It puts the control of the situation in the hand of the caregiver. But it's also, I think, there's a delicate balance between asking for that information because it's very useful to us as a field of practitioners. It's also useful for caregivers to think about it so that, you know, they'd be more apt to want to engage in the use of respite. The tricky part is there's a risk if you ask those questions too formally in advance that the caregiver may feel that, unless it's made very clear, that how they use their respite time might be judged by the people providing, you know, is how I'm going to use my respite time, you know, is that okay with the person providing the respite or the agency providing a respite? So we don't want to ask those questions in a way that's judgmental of how they use their time. In fact, the whole idea of, from my perspective, of respite is to give them a break to do whatever they want, and then it's of interest to us how they actually use that time, so that we can continue to build the case for its value. Thanks, Jill. I just wanted to.
Thanks, Ray, for jumping in on the research piece. Connected to that is we have several requests in here also for your survey instruments, Alicia, and your survey instruments, Cheryl, and anyone else who did surveys around your respite voucher program or any other data collection. If you have your actual survey tools that you'd be willing to share, we can post those on the state respite tools page as well. So I'll be following up with you to see if it's okay if you share this with us. I'm looking to scroll down to see what other questions. We talked about the virtual event in Oklahoma. We have a call from Corey in Nevada. I'm sorry, a question from Corey in Nevada to Megan when you were talking about having 600 people or on your Zoom calls or reaching out to 600 people. She wanted to know how many people you typically have on a Zoom call and what are the age of your caregivers. And I assume the care recipients that they're serving as well. Are you still with us, Megan, in Tennessee? It looks like she might have frozen up. I know she was having trouble with her internet. So we'll get a response from Megan to that question at a later time. Oh, there you are, Megan. Did you hear that question?
Sorry, it kicked me off. I heard the start of the question and then Zoom went away.
Yeah, Corey from Nevada.
What was the question?
She wanted to know what are the age of your caregivers and how many people are typically on a Zoom call, because she'd like to start something like that in Nevada.
Oh, our caregivers are, I think I answered this while I was talking, but I think we've got a caregiver who's as young as 20, and then we've got a caregiver who's in their 80s. So it just really spans the lifespan.
And how many people typically on a Zoom call?
It varies. It's usually just a handful. But it's different people every time. Well, we have some people that are on every single one, but it varies. The people that are on vary, and yeah, it changes each call.
I think when you said 600 caregivers, those are the people that you've been reaching out to and phone calling. Is that correct?
Correct.
Yeah,
correct.
That was a lot of phone calls.
Yes.
Any other questions out there? Well, I see we're actually already beyond our time. at 4 o'clock. I can't believe the time has gone so quickly. Luckily, we have another day tomorrow. We have 10 more wonderful presentations tomorrow. I was going to do a quick update of ARCH products and what's coming up, but I think I'll save that for the beginning of tomorrow's presentation. We may have a few additional people joining us from the network, and they'd probably appreciate hearing that information anyway. So we do have like 2 minutes left. So does anyone have any last minute thoughts or questions? So much wonderful information today. Thank you everybody for participating and staying with us for the whole 3 hours. I hope it was as enjoyable for you as it was for me. I'm sure that it was very amazing amounts of information, and it's so helpful and wonderful to catch up with all of you and to actually see you now on camera. That's wonderful also, since we can't see each other in person. So everyone, thank you very much. You will be getting tonight another reminder, resending your link, your personal link for tomorrow's call. Please check your spam folders if you don't receive it by midnight tonight, and try to test it out in the morning, because I think there were 3 or 4 people who really still had trouble connecting, and I'm not really sure what the problem may have been. So test it out in advance. You can come on, click on anytime, even if I'm not here as the host, and to see if you've got everything working. So thank you all, everyone. Have a wonderful afternoon and a wonderful evening, and we'll see you tomorrow at 1 p.m. Eastern. Thank you all.
Thanks, Jill. Good afternoon, good evening. Bye.
Good evening, everybody.
Bye.